So, good day everyone. I am Josephine Suen and I will be demonstrating the Leopold's maneuver together with the auscultating the fetal heart tone. So, the Leopold's maneuver is used to assess in determining the fetal's line. So, first thing we need to do is to prepare the clients and explain to her the procedures to enhance cooperations. And the next to instruct the clients to empty the bladder so that to provide comfort and to have productive palpation. So next will be we should put a pillow at the back at the head of the clients to have comfort. And the next is to position the client's feet slightly flexed and to have relaxation. Next, we should wash our hands to deter microorganisms and to reduce infections. And then we should provide privacy to our clients to enhance cooperation. So now let's proceed to the procedure of the Leopold's maneuver together with the auscultating the fetal heart tone. So now let's proceed to the first maneuver. So the first thing we need to do is to form our hands like this and put it at the upper abdomen of the mother. So stand on the foot of the bed and facing the mother's head, and then place your hands here. So palpate the surface of the fundus and determine on the consistency, shape, and mobility. So expecting to palpate soft, irregular mass in the upper quadrant of the maternal abdomen. So this maneuver also called as the grip, fundal grip. So the fetal head is hard and round and the fetal's buttock is soft. So next, let's proceed to our second maneuver. So for the second maneuver, face the clients and place your palm on the side of the client's abdomen. So doing like this. So your right hand would be your support and your left hand is doing the palpation. So and then do the same at the opposite side. So this is your support again and this is going to palpate. So this second maneuver, also known as lateral and umbilical grip. So one side of the abdomen you will feel or you will palpate round noodles. So these are the feet of the baby. And you will be expecting that there is movement and kicking. So for the other side, you will be expecting to palpate soft. So this is the back of the baby. So in our case today, the back of the baby is in the left side. So we will now going to auscultate the back of the baby. So we will use this stethoscope as our instrument to palpate the heart of the heart tone of the baby. So we will be using the bell of the stethoscope. So and use our second hand watch to count. So auscultate the baby for 1 minute or 60 seconds. So So the normal finding should be 120 beats per minute to 160 beats per minute. So let's now proceed to the third maneuver. So for the third maneuver, we will going to determine whether the baby is engaged or not engaged. So we will be having an L form, and we will be position it in the symphysis pubis. So this, and if the baby's head is left and able to move, it is determined that the baby is not engaged. And if the head of the baby cannot be moved, so it determines that the baby is engaged. So for our clients, the baby is not engaged. So next, let's proceed to the fourth maneuver, or the final maneuver. For the fourth maneuver, we should face the client's feet and place our hands on the client's abdomen and point our finger towards the mother's feet. So doing like this. Then try to move your hands towards each other side while applying downward pressure. So this procedures is also called as the pelvic grip. So if the hands move together easily, the fetal heads has not descended into the maternal pelvic. And if the hands do not move together, the fetal's head is engaged into the pelvic inlet. So that's all for our Leopold's maneuver and auscultating the heart tone of the fetal. So thank you, and God bless everyone.